Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverdi.
And I'm Montel Williams. Today, health innovation.
New advancements for spinal surgery.
Wow. And we're going behind the mystery of ENPP1.
The Balancing Act starts
right now.
It's a devastating, lifelong disease, making rapid and correct diagnosis critical. 50% of infants will not survive within the first 6 months of life due to calcification and narrowing of their arteries. And worldwide, there are only a handful of adult survivors. We traveled to Manchester, England to meet Dr. Mogul, who specializes in this condition. But first, we're going to meet one family who experienced the impact of this disease. Let's go behind the mystery of ENPP1 deficiency.
I was expecting twins, and when I was 37 weeks pregnant, I was induced. Adrian was born first. I couldn't hear him crying, and that's the first thing you listen for when you have a baby. Janine was born and she cried straight away. They x-rayed Adrian, and really his whole body was dotted with calcium on the x-rays. Janine had it in her pulmonary arteries and her aorta, but not as dense, in smaller amounts. Adrian passed away after his third heart attack at 6 weeks. It was time for us to come home with Janine. And at that time, we thought we were coming home to the same thing. We thought we were coming home to the same thing going to happen to Janine. Nothing had happened to her, which, thank goodness, it didn't.
When Janine was 2 years old, doctors tested tissue samples of the family, which determined she had generalized arterial calcification of infancy. Despite having the name of the disease, little was known about how it would affect Janine's future.
Very few doctors knew anything about it, and we just felt so alone.
There was nothing uplifting. There was 1 or 2 survivors.
In a nutshell, it's getting the information out there and educating doctors and the medical profession that, you know, early treatment can help and can make things better. I mean, if I could have been treated in utero with Adrian, he might still be here today.
The Balancing Act met with Dr. Mogul of the Royal Manchester Children's Hospital to learn more.
ENPP1 deficiency is a genetic disorder which is caused by mutation in the ENPP1 gene. It leads to a deficiency of inorganic pyrophosphate. If you have low levels in the body, you start getting calcification in the wrong places. And one important area is in the blood vessels, which can progress to blockage of the blood vessels. It leads to a condition known as generalized arterial calcification of infancy, which is usually abbreviated to GACI. And as the disease progresses, organs such as the heart and the brain are deprived of important nutrients like glucose and oxygen. You start getting equivalent of heart attack occurring in a young infant, strokes, and death.
There is no cure or approved treatment for GACI, but there are ways to manage the calcium buildup, which is why it's important to recognize it as soon as possible, starting while the baby is still in utero.
Ultrasound scan may reveal excessive amount of fluid surrounding the baby in the womb, excessive amount of fluid in the pericardium or the covering of the heart, and finally it may show bright echoes coming from calcium deposits within the blood vessels. If the diagnosis is not made before birth, it is very important to include GACI or GACI in the differential diagnosis of an infant who presents with symptoms and signs of heart failure.
Symptoms of heart failure include feeding difficulties, rapid breathing, lips turning blue, and cardiogenic shock. A pediatric cardiologist should be brought in to evaluate these infants and perform an EKG and high-resolution CT scan of the heart. Finally, a full-body CT scan should be performed to look for further calcification.
And finally, it is vitally important to confirm the diagnosis by looking for mutations in the two genes which cause these conditions, namely ENPP1 and ABCC6 genes. GACI is a multi-system disorder, and its manifestations are different during infancy, childhood, adolescence, and adulthood.
Infants who survive can go on to develop autosomal recessive hypophosphatemic rickets type 2.
So these infants start losing phosphate in their urine, and their blood phosphate starts to drop. The bones become soft. In other words, they develop rickets, either bowed legs or knock knees, short stature, bone pain, and fatigue. So if the rickets is diagnosed early, it can be treated promptly, thereby avoiding limb deformities.
Other manifestations of ARHR2 include fused vertebrae of the neck, calcific enthesopathy, retinal problems, hearing loss, dental problems, joint stiffness, high blood pressure, and residual effects of organ damage from infancy.
So genetic testing is critical because there are children, adolescents, and adults with hypophosphatemic rickets or osteomalacia in whom the accurate diagnosis has not been made.
Stay with us. We're going to meet Janine when we come back. Welcome back. It's estimated that there are between 11 and 12,000 individuals worldwide with ENPP1 deficiency. Symptoms can vary greatly in different patients, and siblings with the same genetic mutation can have very different outcomes. Here's Janine's story.
Once I got diagnosed with rickets, I started to see Dr. McGall, who's an endocrinologist. So the rickets were treated with phosphate and alpha-calcidol, and that improved the bone density in my bones and got rid of some of the misalignment of my bones, which allowed me to carry on doing the dancing. Went for an X-ray and they realised that I had a fused cervical spine, which is extremely painful, limits range of movement, and can cause a lot of nerve pain. I also started to have a lot of bone pain in my ankles, and it was diagnosed as something called calcific enthesopathies, and it becomes painful and reduces range of movement considerably. I didn't know what I was experiencing was connected to something bigger, but there wasn't enough research out there and enough patients out there to kind of make that connection. The better way to describe my condition was an ENPP1 gene deficiency, which started as GACI and then started to manifest as a ARHR2, the rickets side.
So the doctors need to be aware that survivors of GACI are going to go on to develop ARHR2, and they need to be proactive in monitoring urinary phosphate wastage and blood phosphate levels. So there is no approved treatment for ENPP1 deficiency. So the treatment really involves dealing with symptoms as and when they arise. There's ongoing research into the condition which involves developing targeted therapy, more specifically in ENPP1 replacement therapy, and phase 1 trials will be starting in the near future.
It was helpful to know more about my condition and all the connections, but it was frustrating that there was no effective treatment available to me. The doctors weren't sure how my condition would progress because I'm one of the oldest patients with this condition. And I also started to realise how lucky I was really compared to some of the other patients with this condition.
So this is an ultra-rare medical disorder, and therefore physician education is very important to make them aware of this condition and upcoming exciting treatments that will be available. It is very important that patients and parents advocate for themselves and seek out expert help if that is not available locally.
So my day-to-day life at the moment, I'm in quite a bit of pain. I take a lot of medications to both deal with the pain and also to try and deal with the rickets. I work full-time, but if I don't get any effective treatment and my condition doesn't improve, I'll probably have to start reducing those hours. I'm aware that it affects my quality of life all the time. I feel very fatigued. I see lots of different doctors, and at the moment there's still no effective treatment for myself. My hope for this condition is that it'll improve not only survival, but also the quality of life for patients with this condition. There is hope, and yes, it's a difficult road, but it will get better, and effective treatment will be available, I'm sure of it.
For more information, visit gaciglobal.org. That's GACI global.org, or you can visit our website, thebalancingact.com.
Did you know that surgeons perform around 1.62 million instrumented spinal procedures every single year, including surgeries that involve multiple procedures during the same visit?
That's really amazing.
Yeah.
Spinal surgery is no small undertaking, but technological advances by California-based biotech company SeaSpine are helping make both the surgeon and patient experience a much better one. Take a look. Staying active and maintaining a high quality of life is what we all aspire to. But with more than 16 million Americans suffering from chronic back issues, it can be easier said than done.
There are a lot of things that can cause back pain. There's a complex unit of muscles and ligaments and tendons and discs, little joints that have cartilage and fluid, and then a bunch of little nerves that get in the way when those things deteriorate. And so it's usually the discs or the facet joint, some part of the joint structural aspects of the spine no longer are viable. They become incompetent. They don't hold the spine together well. And so if the muscles can't be rehabilitated to the point where they hold things together on their own, then those joints have to be alleviated of their responsibility in some way.
One reconstructive option is spinal fusion, and scientific advancements have made the procedure more effective than ever.
With these less invasive approaches, where we're able to preserve the structural envelope of the spine, the muscles and the other support structures, that issue's been negated, and now we can deal with those focal problems of a disc going bad, or a facet joint going bad, or the spine subluxing, or moving out of position in a way that's less obnoxious, both early after recovery and then long term. And so part of the technological evolution has been that we now have implants that we can apply between bones that help stimulate the body's engine and influence some of the cells that the body uses to grow bone and mature bone into that area.
Traditionally, in spinal fusions, surgeons like Dr. Islak use implants made of material known as PEEK because it's see-through on X-rays and/or titanium. But each had limitations until SeaSpine married the two and created nanometalline.
That marriage of titanium and plastic now, by applying it in the form of nanometalline, gives us the best of both worlds. We get the appearance on X-ray, which is we can follow our patients relatively easily through radiographs that allow us to demonstrate and see that the fusion is occurring successfully from one bone to the other. It's got the right mechanical properties that sits between the bone without causing mechanical problems like pistoning into or falling into the bone around it. And then it has the benefit of the titanium, which is attracting bone cells, facilitating the fusion through and around that cage. So nanometalline is that marriage of what we knew was good, but it left out the bad and brought in some of the good things that titanium had to offer previously without the negatives of titanium, which is it is a harder metal and would settle into the bone more substantially. So it's a nice evolution in technology that really is to the betterment of our patients.
And the company behind this innovation strives to make a positive impact in patient lives by working collaboratively with surgeons and hospitals.
So SeaSpine focuses on providing implants for spine surgery, specifically for orthopedic and neurosurgeons. And the passion here is absolutely about changing patients' lives and doing it with innovation in spine surgery, but most importantly in the implants that we're able to design, here in Carlsbad, California.
Ultimately, the goal for us is to provide that surgeon the ultimate experience, the ultimate instruments and implants in their hands to drive the best patient outcomes they possibly can get.
This technology has been around for a couple decades, but what we've really done is reinvested in the technology. We've redone the science, we've done animal work, and what we do is every step of the way in the manufacturing process, we ensure that we're getting the very best product. And that product then translates into the OR to help patients restore and get back to activities of daily living.
Other companies historically have had problems of titanium flaking off the implant, whereas SeaSpine has perfected the technology to resolve this issue.
So now we have an inner body implant that helps attract bone, and we have an orthobiologic that's leading on the market. We're the #2 player on the market for this area of orthobiologics. The science with those two products combined is better than anything else on the market.
This market-differentiating technology backed by significant scientific data is a game changer, with more on the horizon.
We're partnering with a company called 7D Surgical. This particular technology enables an image guidance, so you keep updating and referencing what you're doing on the patient, and you can reference back to your preoperative plan. So now you know that intraoperatively, during the surgery, you're matching up to your plan ultimately at the beginning of surgery or the days before. The next 5 years, we're going to demonstrate ourselves as a company that thinks a lot about eliminating or limiting radiation. And that's great for the patient, that's great for the OR staff, and that's generally great for how you seamlessly complete a case without bringing in all other technologies that slow things down.
Spine surgery is, in my experience, universally scary. And most patients dread having to make the decision. So it's very comforting for most of them to understand what we're going to do and the foundation of it and the technology that we bring to them, which involves this great teamwork with our industry partners in advancing the field and making sure that their outcome is optimized.
So in the end, the goal for us is to partner with the doctors, the Dr. Eastlacks of the world, and to do our part and try and contribute with innovative cutting-edge technology to give patients their life back, to remove that chronic back pain and let them live again.
What a great innovation.
Unbelievable. For more information, visit SeaSpine.com or check out our website, thebalancingact.com.
And we'll be back right after this. Thanks so much for joining us today.
Remember to head to our Facebook page, our website, and follow us on Twitter.
Absolutely. And be safe. Make sure you love that family of yours, and we'll see you next time.